In case you didn't know, today is National Wear Red Day. So pull out that red shirt or sweater or jacket or really step it up and wear a red dress today to promote heart health awareness. Heart disease remains the number one killer of Americans, and it is preventable. Stay tuned to learn what you can do to protect your heart. Healthy isn't just what you do, it's who you become. I'm Dr. Vickie, and this is Healthy Looks Great on You, a lifestyle medicine podcast to help you reclaim your energy, your focus, and your well-being. Life tested, doctor approved. Between ages 45 and 64, middle age, the number one killer of women in the United States is cancer. So now you're a card-carrying member of AARP, and the years start flying by, and next thing you know, you're eligible for Medicare. And guess what? The number one killer of women over the age of 65 is not cancer. It's heart disease. And here's the deal. Up to 80% of the time, it's preventable. Preventable. And that's why the American Heart Association created National Wear Red Day to promote awareness and prevention, because heart disease doesn't start in your 60s. What happens is the life you lead before you go through menopause starts catching up with you after. So today we'll talk about prevention, recognition of heart attack in women especially, because it can be unique, and what to do if you think you're having a heart attack. And hint, it isn't cough. Let's go ahead and get this out of the way. You've probably seen that post on social media that starts with I've taken many CPR classes and they never taught me this. Well, there's a reason for that, because it's not true. So please, in honor of Heart Awareness Month, make sure you validate the facts before you try to help others. And I love that you want to promote awareness and you want to help other people, but be diligent, because misinformation can be harmful. And there's plenty of that going around. For today's episode, I'm going to cover what the American Heart Association calls the Essential 8. And I'll give you a link so you can check out their resources, which includes some recipes. But of course, I'm doing it lifestyle medicine, mini medical school style. So let's get started. Number 1 is eat healthy. Gee, where have you heard that before? They recommend a balanced diet rich in whole foods, fruits and vegetables, whole grains, beans, legumes, nuts, and avoiding sugar-sweetened beverages, alcohol, and trans fats. And I love this quote from their website. Don't worry about special foods. A variety of healthy foods is best. Special foods. You try to do something good for your body to make up for abusing it. But seriously, there is no single superfood that you can eat with no regard for your overall health that's going to protect your heart. Heart health requires lifestyle health. So whether you're in your 20s and you want to start protecting your heart now for a lifetime, or you're already in your 6th or 7th decade and you want to do everything you can, even if you've already got some issues brewing. Intensive lifestyle therapy, like that designed by Dr. Dean Ornish, has been shown to reverse heart disease. Dr. Ornish's studies showed that intensive lifestyle changes, plant-based diet, exercise, stress management, and social support can actually reverse plaque buildup in coronary arteries. That's not just prevention, that's regression. And that's the primary reason that if you have a heart attack, your doctor is going to send you to cardiac rehab, where you'll learn about exercise and heart-healthy eating and more. But a better plan is to avoid rehab in the first place by doing the things that have been proven to reduce heart disease by literally decades of good evidence. A whole food, plant-based diet is embraced by people who tend to live long, full of vim and vigor lives, and avoid cancer and heart disease and dementia. Because if you listened to last week's episode, you know that everything that's healthy for your brain is also healthy for your heart. Pop quiz. Why is that? Well, two words: blood vessels. When your blood vessels are open and working properly, then the blood supply to your organs is rich and oxygen is efficiently delivered. In the South where I live right now, the roads are blocked, UPS is grounded, and Amazon is definitely not risking their driver on my icy steps. When blood vessels are clogged, your heart and brain are basically saying, delivery delayed due to weather. Your heart and brain depend on the delivery of oxygen rich blood to be healthy. Want to know what else affects blood flow? Come on, you can guess. It's physical activity. You need 2.5 hours of moderate activity per week. Now remember, moderate activity means you're putting forth enough effort that you could carry on a conversation, but you would struggle to sing a song. I mean, I struggle to carry a tune, but that is not what we're talking about. If you can belt out "Don't Stop Believing" at full volume, you're not at moderate intensity. But if you really want to step it up, then 75 minutes of vigorous activity does a heart good. But the beauty of exercise is that every little bit you do adds up and the benefits start immediately. And regular physical activity can reduce heart disease risk by 20 to 30%. Exercise gets your heart muscle pumping and blood vessels open up so that more blood is flowing. But I want to tell you about something that causes blood vessels to clamp down. You may know that I practiced obstetrics for 20 years, and every once in a while, one of my sweet pregnant mamas would sneak into the bathroom and light up. Tobacco addiction is real, but it's hard to hide, especially in a hospital bathroom. I mean, we could smell the evidence and we could also see it, and the nurse would go in and strap those monitors around the bulging belly, and the baby's heart rate would show signs of distress. And if we had not known the cause and that it was temporary, a stat C-section would have been called. Now, we smelled the smoke and we saw the fog in the bathroom, so we knew it would pass, but that's exactly how fast nicotine clamps down blood vessels. Minutes, not years. But it also underscores how profoundly smoking affects blood flow, and I think it also underscores how very hard it is to quit. But there are some good resources, and I put some links for you in the show notes. Number 4 on the list of the American Heart Association Essential 8 is sleep, and I love it. If you don't get around 8 hours of sleep per night, you might want to check out all of the sleep resources on my website, healthylooksgreatonyou.com, because sleep is my jam. I took a special interest in sleep when I realized how little I knew when I was studying for my lifestyle medicine board. Exam. Discovering that poor sleep is associated with heart disease and dementia and diabetes, which all run in my family, I made sleep a priority. Now, one time I had someone get mad at me for saying they needed to prioritize sleep. And trust me, I get it. Because the harder you try to sleep, the harder it is to sleep. And that's one of the reasons I've created so many tools for you to improve your sleep. Sleeping less than 6 hours a night is associated with an increased risk of high blood pressure, diabetes, obesity, and heart disease. So if you have trouble sleeping, check out a resource I have for you. Next on the list is healthy weight management, which feels a little redundant at this point because if you eat healthy, avoid alcohol, exercise, and get proper sleep, then you're already doing your best to manage your weight. And of course, there are other factors that you can't control, like genetics and age and hormones, and to some degree, stress. But lifestyle is essential for maintaining a healthy weight, which has a huge impact on heart health. Now, the next 3 can be summarized as health maintenance. Control your blood sugar, cholesterol, and blood pressure. And those all deserve their own separate episodes. But if I can sound like a broken record for just a minute, eat plants, eat different plants of different colors, fill up on fruits and veggies and beans and legumes and nuts and seeds and whole grains and all that good fiber that nourishes a healthy gut microbiome. And move a little and move a little more and move a lot. Avoid alcohol, tobacco, and saturated fat, added sugar and excess salt, and get your Z. The essential 8 boils down to 3 big buckets: what you eat, how you move and sleep, and your health numbers. And let's take a short break, and you can flip that tassel on your graduation hat, and then we'll move into clinical rotations and talk about recognizing and responding to the symptoms of a heart attack. The hallmark sign of a heart attack is chest pain that may feel like pressure or tightness, or it may actually be pain or just a squeezing or aching. Pain or discomfort that spreads to your shoulder, arm, especially left arm, back, neck, jaw, or even teeth. Sometimes the upper belly should get your attention. Some people go into a cold sweat, they feel extreme fatigue, they may feel what they think is heartburn or indigestion. When my grandfather was having a heart attack, he took a whole roll of Tums. You may feel lightheaded or get dizzy all of a sudden. You may experience nausea or shortness of breath. But here's the deal. Even though chest pain is still the hallmark sign in women, women are also more likely to experience things like anxiety. And that nausea can be also vomiting, shortness of breath, upset stomach, pain in the shoulder, arm, or back, unusual tiredness and weakness. Hollywood tells us that heart attacks look like a man clutching his chest and collapsing. But women may feel flu-like symptoms, like crushing fatigue, or jaw pain or back pain, and often they wait too long. Here's the deal. If something feels not right for you, trust that instinct. And if you think you might be having a heart attack, here's what you do. Listen carefully. You call 911. You might consider taking an aspirin while you're waiting on the ambulance, but don't delay. Call 911. And don't just wear red, live red. Move, sleep, eat plants. Know your numbers. Your heart is keeping you alive every second and with every beat, and it deserves a lifestyle that loves it back. So even if you need help to get healthy, get the help you need, because healthy looks great on you.
The information contained in this podcast is for educational purposes only and is not considered to be a substitute for medical advice. You should continue to follow up with your physician or healthcare provider and take medication as prescribed. Though the information in this podcast is evidence-based, new research may develop and recommendations may change.